For today, we're talking to Dr. Hussaini from Tennessee State University, who is the director of the Center for Health Research at Tennessee State University. And of course, Dr. Hussaini, before we had our first commercial break, we promised that we'd give you an opportunity to sort of elaborate upon the Center for Health Research at Tennessee State University, because from what I understand, it is somewhat of a novel kind of research center, and talk about it from that perspective, about what the groundbreaking kinds of things that you've made in reference to this center.
That's true. This is a freestanding center at the campus. That means it exists simply because I keep on bringing federal grants or state dollars for the center to do various projects that ultimately feeds into developing new policies. Okay, that is the ultimate game. But in the process of reaching that goal, we train junior faculty, we train graduate students, undergraduate students, how to do research in health services areas. Now there are, as you may know, that federal government gives about 17–18 billion dollars a year to conduct research to NIH, National Institute of Health. Okay, $18 billion. Oh, these are competitive dollars that are given out to various universities. So we at HBCU, TSU is one of the HBCUs, just like Meharry is. We have to compete with anybody else who's going for the same dollars. So we can only bring money if we win. Okay?
Okay, that's very good.
Yeah, that is a very important point too. It is not that it is doled out to Tennessee State.
You don't just write a grant and automatically get money.
No,
you have to
not
win.
at all. It has to be of top quality. It has to meet the needs. It has to add to the scientific field of knowledge. It has to help develop new programs, new policies, new drugs, whatever it is. But those dollars have to be brought in that way. So we are a free standing research center that exists simply because we keep on bringing monies. Now there are 4 areas where we have concentrated. One is the cardiovascular diseases, looking at cardiovascular disorders throughout the state of Tennessee and elsewhere, along with stroke. That's one area. Second one is cancer, where we are looking at screening for colorectal cancer, prostate cancer, breast cancer, and doing projects in those areas so we can benefit the community which is impacted by these issues. A third area is mental health, which is dealing specifically with depression. As you know, depression, this is where we do a lot of work. We do group therapy, we do all kinds of projects identifying where are the areas that are where the people need help. Okay? And the fourth area is HIV, AIDS.
Okay, good.
We are doing research in that area, and we have Dr. Lin on my staff who has been doing a lot of work. He has done work in Botswana, Ghana, Brazil. Now he's taking his work to AIDS prevention, HIV prevention, to South Africa, as well as Mozambique. So he is collaborating with Vanderbilt. Okay, so these are the 4 major areas, and cutting across all these areas, there are 4 themes. One is to actually reduce health disparities in all areas. Because we find HIV, cancer, depression, cardiovascular diseases, and I will show you more impact of the disparity, how it is, because if people are sick in those areas and don't get help, eventually it leads to higher mortality, and that's where the biggest gap that one can determine, you know, one can observe that.
In other words, you might be able to argue about cancer and all of these others, but when you talk about mortality, people you talk about a disparity in mortality, you're really dealing with that's the nub of the whole issue. That's right.
But how can we narrow that disparity? Well, there are programs, that community outreach program, educating the people about symptoms, where to go, how to get in there, how to get help, you know. So those are the activities. We have done projects dealing with increasing mammography rates through black churches in Nashville. We have done projects dealing with prostate cancer screening.
Okay.
Raised it by about 22% through black churches here. So there is a greater need. This can cut down on mortality that is taking place among the females, African American females and African American males, due to two sides of cancer that we are talking about. Okay? So these are the community outreach work that we are doing, and we are doing it because we want to prevent those diseases. And that is what is critical here to see. So that's our mission. Now, recently, one of the things that we are doing is to examine the burden of cardiovascular disease for the entire state of Tennessee. Entire state of Tennessee. That means not only Davidson County, but all 90 counties in the state of Tennessee, to see where are these diseases, who is dying, where we need to develop new programs and services to cut down on those health disparities that we observe. So if you look at the map here, for instance, I just chose 3 areas: heart attacks, congestive heart failure, and stroke. These 3 areas where we find a very high mortality rate, which is impacting the black community
more than any other,
other group. So if you look at the map here, you will find the distribution of high rates, which is shown by the red counties, where you have a higher rate of heart attacks taking place, where you have a higher rate of congestive heart failure, and also stroke that is taking place. A stroke is impacting the black community very greatly.
And of course, Doctor, we're getting ready for our second commercial break. When we come back, we'll allow you to continue talking about this disparity. But I think that this is the information that we wanted from you. And of course, we'll be back with our audience following this very short commercial break.